Hello, this is Paul with All About Neurofeedback, and I wanted to introduce Dr. John Silva. We've known each other for quite a long time, and he does a great job. And I just wanted to get him to maybe start by giving us a little bit of your background and what brought you into neurofeedback. So if you could just kind of let us know a little bit about yourself, please.
Sure. Again, Dr. John Silva. I've been practicing here in Port St. Lucie, Florida for 22 years now. A chiropractic physician, as I say, by trade, but my practice has evolved quite a bit over the years. Got into neurofeedback well over 10 years ago, predominantly out of need for my son, who at that time was about 10 years old and had been suffering with ever worsening anxiety and some OCD traits. It got to the point where during the course of that year, he had a couple of bad panic attacks that had seemed to come out of nowhere. And give you a little background on our family, we're very healthy people. We keep ourselves healthy. Grew up in a wellness lifestyle. My son was raised that way. Never really sick throughout his whole life. For him to be suffering this way, which just seemed unusual for us, but nonetheless, it got worse. So interestingly enough, I had known a little bit about neurofeedback, but never really explored it. So I happened to be at a neurological conference in Orlando just about a week after one of his really bad panic attacks, and had been introduced to QEEG brain mapping and neurofeedback, and brought literature home that week and studied it. And I looked into it and said, for nothing else, let me at least do a QEEG brain map to see if the source of my son's problems were coming from his brain. So invested in the technology. He was the first official brain map I ever did in my practice. Of course, I was new at all this, so I needed some guidance from my mentors and such, and they guided me through the process. And sure enough, you can clearly see where his problems were coming from. So we, needless to say, got busy doing neurofeedback sessions. And to my amazement, within just a couple of weeks of him sitting in my office where we set up our neurofeedback room, because my intention was to bring this to a lot of my patients who were also suffering with a lot of different conditions that were warranted for neurofeedback. But sitting there at the computer, watching him do his sessions, and watching him at that time watching SpongeBob SquarePants, which was his favorite show, and just watching the visuals of the screen transition. He had headphones on. We also incorporate brainwave entrainment, which uses specially designed glasses, and to just watch him break out of this cycle of anxiety and panic, and his OCD symptoms go away. Needless to say, it took about 3 months to get him fully resolved, but that was over 10 years ago, and he is now actually going to be 22 next week. And you would never know he had that hiccup in his lifetime. I mean, he's the most mellow, laid back kid you'd ever meet. So that really set me down this path, and it has completely changed my practice. I predominantly specialize in helping people with what I call brain-based disorders, predominantly through neurofeedback training or neurofeedback therapy.
Okay, so that's pretty amazing. The very first patient was your own son, and the results. How did that make you feel when you saw those changes? It must have been pretty amazing.
Oh, it was, and so to go touch on my career. So I started as a chiropractic physician, helped people for many years with a variety of musculoskeletal and neurological problems, mainly pain-based problems. So helping them through the different therapies and services to get over their acute and chronic pain, or better manage it at least. But the whole thing about chiropractic, for people that may not know, the whole foundation of the chiropractic profession and what we do is really to help get the entire neurological system functioning better through spinal adjustments or spinal manipulations. So, and I've always, in my own personal quest for health, even before I became a physician, was always open-minded, always loved to learn, explore, especially when it came to health and wellness and well-being. So that didn't stop after I finished school and graduated. So I was always attending postgraduate trainings. I did a number of things over the years, offered a number of different cutting edge therapies and technologies, things like low level laser therapy, pulsed electromagnetic field therapy. At one point, I had two hyperbaric chambers in my clinical practice, and really helping to really get to the root cause and offering some of the best cutting edge technologies and therapies for my patients that were suffering. Again, a variety of musculoskeletal neurological conditions. So my practice at that point, prior to my son's experience, was kind of poised to bring neurofeedback in. Again, had heard about it, but didn't realize what it was until his experience. And once I saw that, I'm like, this is what we need. I mean, this is the most direct way that I know of to influence our brain physiology for the better in a non-invasive way. So it has completely changed the practice. And of course, his journey is just one of many people I've worked with over the years that have really been able to turn their life around as well.
It's really interesting to know that, because neurofeedback has been around for decades, and, there's more and more studies and literature and technology that's coming out around it, but yet most people still don't understand it or don't know anything about it, right?
Mm-hmm.
Which, is why we're doing all about neurofeedback and doing these interviews, is to bring awareness. But what have you seen to be the changes over, what, 12 years that you've been doing it, it sounds like?
Yeah, just about 12 years.
Yeah. I mean, the technology's improved and, I imagine the outcomes have improved also.
Oh yeah, yeah. I mean, vastly. I was fortunate enough that that equipment I invested in was designed in such a way, the neuropsychologist and the team of doctors who designed it made it, especially for newbies, into this realm of QEEG brain mapping and neurofeedback. It
Right.
made it easy to get in, jump in, and start getting desirable outcomes for our patients or clients. Because at that time, I was also talking to other practitioners from different backgrounds and their quest and their journey into neurofeedback. And what I come to realize is it can get pretty complex. You can really get caught up in the neuroscience, the technology, the software that runs the systems to do brain mapping, to do neurofeedback sessions. And I saw a lot of my colleagues and people who got in it and got out of it pretty quick because it was just too much to try to figure out. In addition to running their typical practice, and of course, I associate with a lot of chiropractic physicians. So, like myself, they were looking to bring this in as another way to best serve their patients in a whole new way. But a lot of them ended up dropping out because it was just too much to try to figure out and understand. So I was fortunate in that respect that the equipment I was using and the software and the technology had a lot behind it, and it really helped me to understand what was going on. And of course, since that time, I've then ventured on to use various versions of it. But at the end of the day, it doesn't. What I've come to realize is it doesn't have to be that complex as some
Right.
of the systems may portray it to be. And like anything else in life, and even in clinical practice, sometimes just the simplest things have the most profound effect. So it's been quite a journey. In these last probably 5 to 6 years now, the technologies have gotten to a place where now we can actually do this in a home setting. So I now work with over 1,000 clients globally, from as far as New Zealand, Asia, and of course throughout the United States, North America. So it's been quite a journey.
Wow, you must be pretty busy with that many clients that you're
I
working with.
am. I'm fairly busy, as busy as I want to be. And again, with these technologies, it's really opened up the insight, and it's given me too is, the struggle is not just real for your local practice and its community, and expand that out to your state and nation, but the struggle is real worldwide. I mean, I talk to people no matter what part of the earth they're on, they're struggling with everyday stresses, anxiety, sleep issues, attention focus issues, memory problems. The struggle is real no matter where you are. So
Right.
neurofeedback is one of those universal things. We all have this a similar functioning brain, and it's just a way to tap into that healing ability and get the brain in a better state.
So on your website, you talk about a range of things that you do outside of neurofeedback. Is there anything else that you do in conjunction with neurofeedback to get better outcomes?
Yes, I mean, well, first start with quite a history, and some questionnaires that I have people complete from the convenience of their home on their own device. These really delve into their physiological well-being. So we have an assessment that basically have them answer questions from head to toe, just to see what other systems or parts of their body can be manifesting in these brain-based problems or correlated with that. We also delve into their emotional well-being, their cognitive well-being. We will do cognitive performance tests. So we get a really good foundation. And of course, people who live locally to my practice here in Port St. Lucie or are willing to travel here, we can of course do a quantitative EEG brain map, which is then taking that data along with those questionnaires and assessments like the cognitive performance test and give us a really comprehensive profile to determine how we can help them. And again, in terms of the neurofeedback sessions and neurofeedback training, but also if there are any other things that we can offer them in a home-based setting is predominantly where my practice is at, because a lot of things that I mentioned earlier, like low-level laser therapy, even oxygen therapy or brainwave entrainment therapy, the technologies have gotten to a place where they become much more affordable. You don't necessarily have to go to a clinic for these, and they can easily, with some basic instruction, be done from home. So when it comes to specific brain-based disorders and using neurofeedback, one of the primary things I will typically use with my clients or patients is brainwave entrainment. So basically the use of light and or sound stimulation through specially designed glasses and headphones to also help get their brain physiology in a better functioning state. And it complements neurofeedback training sessions very well. And I've seen even
Yeah, I can
better
imagine.
outcomes. Yeah.
That's where I first got interested with neurofeedback. It was actually before neurofeedback, it was brainwave entrainment. It started with
Yeah.
holosync and then ended up getting some devices like Mind Alive, for instance.
Yes. Very familiar with
So
that one.
yeah, so very interesting. So I found those to be extremely helpful.
Mm-hmm.
It's not pure. I think the difference between entrainment and neurofeedback is important because a lot of the devices that people are downloading apps or they buy a tracker or they see something on YouTube, that's really based around brainwave entrainment, right? And
Yes.
what that's designed to do is to sync your brains into a different pattern than they are now, right? So
Yeah.
it's kind of like a one size fits all versus neurofeedback, where it's actually looking at your particular brain and feeding back information to improve your particular brain, right?
Exactly.
So
Yep.
yeah, so it's definitely a therapeutic, way of doing it versus just kind of like this mass market thing that, people can get benefits for sure, but it's not the same, right?
Yeah. Yeah.
Kind of along those same lines, like I know you're not a therapist, but a lot of people that come to you, I would imagine, have gone down different routes. They've done the talk therapy, they've done the medication, they've done all these things. And a lot of times, from what I understand with, the clients I work with, the neurofeedback providers, is that most people that come to them are kind of at the end of their rope. They've tried everything and it hasn't worked, right? Is that
Oh, yeah.
kind of what you see too? Yeah.
Most definitely. Yeah. Yeah.
Okay.
They're at the end of the rope. They've, like you said, tried, they've been going to therapy sometimes for decades to some help. They've gone through sometimes several therapists trying to find just that right one, different medications. Of course, there's other beyond therapy and medication, talk therapy of medications. There's a number of other things that I know people have tried, but at the end of the day, and people, they resonate with this when you sit down and have this discussion, but at the end of the day, none of those things are really getting to that root source, which is their brain waves just not operating within that optimal normal range. And that's easily measurable through EEG. I mean, EEG as a diagnostic tool has been around for decades. And then quantitative EEG just takes it to another level to really be able to map out each region of the brain to see where these imbalances or weaknesses are, as I describe them, or these dysregulated patterns. And once you can identify those, you can see where that person's anxiety or their depression, or even look at some of the things that could be causing, because the brain will leave telltale clues in terms of these brainwave patterns as to whether their struggles could have been mainly from toxins over throughout their lifetime. Biochemical toxins, was it more from emotional stressors, such as things that would constitute PTSD? Did they have some significant emotional trauma throughout their lifetime or repeated trauma? Or was it more related to a head injury or physical trauma? So it's really insightful not only to help us deliver the right neurofeedback training program unique to their brain's needs, because everyone's needs are different, but also gives us, especially me as a functional medicine practitioner, it gives us more insight as to what other directions we can take that will complement the neurofeedback to really keep working what I call upstream to get to those root causes. And the more we can combine that with neurofeedback, I've seen, again, more rapid results, better outcomes overall.
Right. A lot of therapists are embracing neurofeedback as well. And I think there's a lot of value in talk therapy and counseling. I think it's very helpful for people, but at the same time, like you said, you've seen people that have been in therapy for decades, and this can collapse that to, a few months, right? For
Mm-hmm.
not for everybody, but I imagine for a lot of people. So it's interesting to see. And I think the other thing that I like to distinguish is it's kind of like the whole idea of your brain-based disorders based in the chemistry of the brain, but it's really more in the electrical activity of their brain, right? And that's one
Yes.
of the things that, the medications might mask the symptoms for a while, although they come with a lot of risk.
Mm-hmm.
Um, but actually getting to that root cause is really the electrical activity in your brain, right?
Yep. And
You
that's what
know?
neurofeedback is all about. And to expand on that, yeah, another discussion I typically have with people, and they've kind of figured this out, maybe not fully brought it to their conscious level, but they understand this, especially those that have been taking medications and tried different medications to no avail. And I asked them, simply asked them, I mean, at the end of the day, you're only good until your next dose. If you were to completely stop your medication, is your problem fixed? Is it resolved compared to when you first started taking this medication? And the answer is usually hands down no. I mean, I have to take that next dose in order for me to even somewhat remotely function. And of course, a lot of them do experience those side effects. And that's why they have to keep adjusting the doses or changing them onto a new medication or adding to it, which is even worse. I mean, I work with people who are taking multiple medications, and it's all chasing that biochemistry, but in reality, it's looking at the electrophysiology, how our brains are functioning electrically. Chemistry follows that. So when you can get to that ultimate root cause, I mean, that's a game changer. And I've seen people, again, they've been on some of in the terms of neuropsychiatry or pharmaceuticals, some of the most advanced and best medications out there, but they still have their problems at the end of the day. And then you do a couple months of neurofeedback, and it's amazing the changes that they go through. And again,
Right.
what's amazing too is you look at their QEEG analysis, their brain maps, and you would expect to, if the medications are supposed to be fixing something by some point, we would expect to see some good QEEG brain maps. In reality, it's just often the opposite
Right.
because a lot of this chemistry will drive their brain further into a dysfunctional state. Yeah.
So it's not pseudoscience. It's not a conspiracy theory. It's not about being against big pharma. It's really
Mm-hmm.
about just what works, right? And I
Yep.
think that fundamental understanding isn't really something that most doctors are trained on. So it's not, there's wonderful doctors out there. We're not anti, doctor at all. But at the same time, as somebody goes through a process like this, I imagine you're getting to work with their, maybe prescribing physician to make sure that they're not going off any medications too quickly, that kind of thing, right? Like
Oh
you guys
yeah,
are
most
pretty,
definitely. Yeah.
yeah, yeah,
Yeah, I get that question a lot, and I always tell people who are coming into my practice, continue taking your medications as prescribed. As you start to feel better, as the neurofeedback is having its effect, then uh, consult with your prescribing physician and let them work on, especially with the antidepressants and certain medications, they have to titrate or change those doses. But I've seen plenty of people who have been able to come off their medications or at least
right.
significantly reduce the number of medications they're taking or the dose that they're taking. Yep.
So would you say that like everybody sees a significant improvement, or is there a percentage that you see? Like, what are your success rates?
Yeah, I get this question often. As long as as a person is committed to doing the work, which means doing the neurofeedback sessions, and again, in today's day and age where majority of my clients are all doing this from home, so there's really no excuse at this point because you have access to your neurofeedback sessions 24 days, 24 hours a day, 7 days a week. It's just a matter of getting the work done. And as long as you're consistent and we're working together and we're monitoring how your brain is going through this neurofeedback process, day to day, week to week with your sessions, we will see outcomes, positive outcomes. Where I don't see them is when, again, people come into it, maybe they're excited to feel well, maybe they start to feel a little well, and then they self sabotage. And this is where
Right.
I can always refer back. Of course, there's a time and place for everything. I help people to maybe get to a therapist to help work on their mindset. Of course, I do have tools to offer them in that respect as well. Sometimes it takes that to just get them to be motivated enough to just sit down and, I mean, neurofeedback, as you know, Paul, is very easy to do. We're either listening to music that fades in and out or watching some type of visuals like a movie on a screen. So there's really no excuse to not do it other than
Right.
maybe the few minutes of prep time to put the equipment on your scalp. But otherwise, it's easy to do. But as far as success rates, I mean, I'd have to say 90% at least, if not more, for those that
Right.
stay committed to it and go through the process. Yeah.
Is there any conditions that you've kind of seen that are particularly troublesome that maybe you don't get the best success rates on?
Yeah, so there are a couple of more what we constitute in the neurofeedback realm and the practitioners, my colleagues, OCD, obsessive compulsive disorder. Not to say it can't be helped. It is one of those things that we know can take a bit longer. We have to really follow those clients and really monitor how their brain is responding and be willing to adapt to how their brain is going through the process for long term and the most successful outcomes. It's one of the more challenging cases. Of course, PTSD as well, especially if a person has had a long history, like a lifelong history of repeated traumas. It takes a lot to integrate and get some of that effect, that electrophysiological effect of what that trauma has done on their brain. It can be done, and again, that's the effect of anything that I've ever helped people with. The anxiety and depression that come from PTSD trauma is probably the most rewarding, because I've seen people, I mean, that have again done so many other things and they just can't get past how their brain is holding them back from the trauma that they had maybe 20 years ago. And when we start doing this type of neurofeedback, in fact, there is specific type of neurofeedback for trauma. It is amazing how their brain can just go in there and declutter the effect, I guess you could call it, and then just a big turning point in their life. Yeah.
I'm aware of different studies going on, and also a number of my clients that do focus on PTSD for, first responders and veterans, right? So what you're saying is, yeah, it works great, but it takes more work. It takes more dedication to get to that point. Is that kind of what you're saying?
Yeah, and this is oftentimes where we'll have to use what I call multi-therapeutic approach. So we incorporate things like brainwave entrainment. Perhaps we have to refer out to a therapist or use some type of therapies to help them with their mindset as their brain is coming around, functioning better. Perhaps we need to order some laboratory testing to look to see if there's any presence of toxins, or are there any underlying infections, subacute infections. All these things. And this is just the realm of incorporating functional medicine into the neurofeedback realm. But it's still amazing. At the end of the day, neurofeedback still comes through. And I mean, again, when you can, especially for those people that need to detox or need to change dietary habits, because all these things have a role in how our brain works. But even those people who never do anything else that I may recommend can still see benefit. And that's the most amazing thing about it compared to any other therapy I've brought into my practice. And I've personally used myself. I mean, it's like the core, and I explain it in just that way. This is the core. This is the base of everything else that we need to work on. And where this really shined through is I had a patient years ago who came to see me predominantly because of just day-to-day stressors, anxiety. She was just being overwhelmed in her family life, her work life, and sleep issues. So mostly all these what we call brain-based disorders. So we started doing neurofeedback, and of course, those things were improving and this is back in the day when I was doing neurofeedback sessions in the clinic. And we, of course, would check in every time a person comes in several times a week and just how's their day going? How's their week going? What kind of improvements are you seeing? And she was moving right along as everyone else does. But one thing we never discussed, and she never brought into the conversation when we went through her history, was this chronic foot pain she had in her right foot and ankle. And she had, in fact, she works at a local hospital in the administrative department. And she had gone to the orthopedist there. She's had MRIs, she's had physical therapy, she had injections, she had medications to no avail, still had this chronic pain. Interestingly enough, she asked me one day after one of her neurofeedback sessions, she goes, "Doc, is it possible that what we're doing here with neurofeedback in my brain could be making my right foot pain get better?" And at first it took me back. As the first I've heard of it, I'm like, but just again, understanding basic neurology, which we learn as chiropractic physicians, there's that connection. Yeah, ultimately we have parts of our brain that process and allow us to feel that pain, which in a lot of situations is a good thing. It's just when it becomes chronic and never ending, it becomes a bad thing. So I told her I'm going to look into what we've been doing as far as your neurofeedback sessions and come back with a full answer for you, at least the best of my knowledge. And yeah, sure enough, I mean, the particular region of her brain that we started doing the neurofeedback sessions on correlated with her extremities, or lower extremities in particular. And I said, yeah, there's no reason why your brain is now functioning better able to kind of manage that pain or be less perceptive to it. It got to a point where, I mean, it wasn't fully resolved, but not doing any therapy directly. And I do have the therapies. At that time, I did have the therapies to easily work on her foot and ankle. But we never even touched her foot and ankle, and her foot pain, which was just like a side benefit, improved.
That's pretty wild.
So so to answer your question is, it really is become the basis of anything that we have going on in our body. Because if you think about it, I mean, just simply put, you don't even have to be a doctor or neuroscientist to understand this. Our brain is the master controlling organ of every other organ, every other system, every physiological function from head to toe. So wouldn't it make sense to at least look at the brain as a potential means of getting well and feeling better, whether it be physical pain, emotional pain, or a combination of both? And my answer
And
is
I
yes. I
don't
mean,
think it can be understated, like overstated how impactful it is too, because like you just said, the brain controls every part of our body, but it also controls almost every part of the experience of our life, right?
yeah. Mhm.
And if your life isn't working and things aren't coming, work sucks. I mean, if everything is not working and you start improving your brain, all of those things get better, right?
Yeah.
And that's, I know that you're pretty into the nutrition side of things as well. You start pairing that with, the brain and what you can do with neurofeedback. It's a complete game changer. And I've seen
It
that
is.
in my family and, a lot of my clients, obviously, and all their clients. So it is pretty amazing to see though, right? Like it can't be overstated. And you look at today's world with COVID and all the politics and all the crazy stuff going on and the stress that people are going through. It's like you're off balance all the time, right?
Mhm.
And I would imagine, when you get people coming in, even their experience of those things improves, right? They just are able to relax into themselves a little more and focus better and all those kind of things, right?
Yeah. Yeah.
No.
Most definitely. Yeah.
So even if they come in for one thing, it probably flows over into other aspects of their life as well,
Yeah. Yeah. I mean, and again, I try when I relate to the brain and bringing everything back to the brain, because that's where it's all at, is our brain is responsible, like I mentioned, for all of our physiological functions, including our cardiovascular system, our last meal digesting, our ability to drive our car and get to work, and our ability to have a conversation right now, all those cognitive functions. Our
Yep.
brain is also responsible for our emotional well-being. Every emotion that we have is ultimately coming from our brain. And of course, our brain is responsible for our behavioral well-being. So we may have kids, or we may ourselves may not act in best behavior, especially in social settings or amongst our family members, and that becomes disruptive not only to ourselves but beyond ourselves. And that's in essence how our brain functions. I mean, those are the functions, the primary functions of our brain. So when we can identify weaknesses or imbalances and then start to correct those through neurofeedback. And again, other things too, but neurofeedback being the core, we would expect that, hey, cognitive functions, our emotional well-being, our behavioral well-being, and even like I mentioned with chronic pain, but other types of physiological problems would expect to improve to some extent. Again, you still may have to work on that particular organ or that particular system. And in my realm, it's from a natural perspective, but we start there. And the brain controls and coordinates everything. Yeah.
So it's easy for people to do at home if they have somebody that can guide them through it and is painless. It's not invasive. Um, there's really, is there any disadvantage? I mean, what do you think?
There really isn't. I mean, there's no adverse side effects that I've seen in my clinical practice. Once in a great while, if we're putting the sensors, and for those that have completely new to this, and perhaps seeing this podcast or this video podcast, when I talk of sensors that we put on the scalp that we use for neurofeedback, and they come in a variety of different formats, but those sensors aren't emitting into anything to the brain. They're just identifying and reading brainwave activity in real time, which is then computed by the neurofeedback hardware and software. But occasionally, what I've noticed, training or putting the sensors in the frontal part of the brain, once in a great while, I might have someone report to me that they feel a bit of a headache or a little fullness in their head that easily dissipates after a few hours. But that's about it. When I'm doing trauma type neurofeedback, sometimes we may experience what I call integration, where they may have an emotional response. In fact, these neurofeedback trauma protocols or sessions that I do, I've seen people sometimes within minutes of starting up their session. And what they're doing during these sessions is their eyes are closed while they're listening to music that they get to choose, something they know they can relax to. But I've seen sometimes within minutes of starting the session, they start to have an emotional response. Their eyes start tearing. They didn't realize it's happening. And then on the flip side of that, have had people start start feeling tense. They start grabbing onto the chair they're sitting on, and again, they don't even realize it when you stop the session, because we're trained to notice this. you stop the session and like, well, I didn't realize that was coming up. It's their brain integrating this bad electrophysiology, if you want to call it, from the traumas throughout their life. So that was really that really again took me to a whole new level of wow, this neurofeedback stuff is amazing. When I
Yeah.
did some postgraduate work on trauma neurofeedback and then started applying it, and I took a few select clients, but knowing their history, I'm like, you know what, let's try this. It's different than our approach where you were watching videos. Let's try this. And it was incredible, some of the responses. Again, so that would be about the only negative adverse effect I've ever seen is, again, maybe a little bit of a headache after a session, but again, very, very rare. Or if we're doing trauma neurofeedback, a person may experience a little bit of emotional release, what I call integration, which ultimately is at the end of the day is a good thing because it's a sign that their brain is working through what that trauma did electrophysiologically to their brain. It created these short circuits, and we're now repairing those short circuits, is the way I like to describe it.
Even with just with brainwave entrainment, when I first started with that, the first week or two was kind of hellish, right?
Mm-hmm.
Like everything got a little bit worse for a while. And I was prepared for that because, the program that I had bought into at the time explained those things, that was going to happen. So I pushed through, and after just a couple weeks, even just with entrainment, I mean, it really did change everything for me in terms of my ability to handle stress and my ability to not be reactive and those kind of things, right? So yeah, it's an amazing technology, So
It really
people,
is.
can come and they can do it from home. You have a free consultation, I know that you do. We'll link to that in your profile. And you also have a really nice little ebook to kind of explain a lot of this stuff. And it's on your website, but we'll also link it in your profile so that people can easily download that. And, that's awesome. So do you have any final thoughts or things that you would like to share?
Yeah, for anyone that's tuning into this, you can research all you want, but you just have to take that first initial step, and either a provider like myself or anyone else that might be local to you, although a lot of us practitioners like myself have the ability to work with people and clients throughout the United States, Canada, and globally. But just take that initial step and set up a consultation. I do offer complimentary consultations to at least open up that discussion to see if neurofeedback could be right for somebody, and then take a look at what those next best action steps would be. And of course, if you're able to get to a clinic like mine, the next best step would be a QEEG brain map. But even if that is out of the range or realm of possibility because you live too far from a clinic that does those, there are ways to do what we call mapless training. And we can still get very desirable outcomes. And again, all of this can be done from home, which is great. In fact, I'm looking at technology right now to be able to bring this experience completely home, where we can do a quantitative EEG at home. Basically, I envision, and this is coming up here within the next several months. I've actually sought a company out of Moscow that developed what we call a disposable QEEG cap. So it's a one-time use cap. It's pre-gelled. I'll ship it off to someone with the hardware and software program. So that's all they need to do is hook up my computer to their Wi-Fi connection. I can then remotely access their computer. The apparatus or the cap is very simple. You just Velcro in a few points. They just plug it into the hardware I provide them, and from there I take over from whatever distance.
I
So
think it's probably really important to say that this is not mind control.
no, yeah,
Right?
that's a good point.
There's nothing being put into your mind.
No,
I know that there's a lot of young people that if they go through neurofeedback, that's one of the common things that comes up is, well, what are you doing? Are you trying to brainwash me? Right?
yeah,
And it's not like that. So when you hear these caps and these electrodes and this technology, it's really about reading what's going on in your brain, not putting
exactly.
anything into you, right? So it's not like a, quasi Neuralink kind of thing that you're hearing about today. It's really
Yeah.
about just find out what's going on. Is there people that you don't work with?
Really, the only people I will not work with are particularly seniors that are too far down that path of cognitive decline or dementia.
Okay.
And I learned this from working with a couple of clients over the years, and despite knowing that we weren't going to get the best, if any, outcomes, their spouses, and that's usually what happens when people go that far down dementia. They don't even realize they have a problem. Everyday life is just hunky dory, but they don't realize that they're struggles, and it's their spouses or the significant others or people who are their caretakers that are stressed out because they see their loved one going down this path, and they're desperate to have anything done. So I've worked with a couple of individuals. We were able to help them to some extent, but we couldn't reverse or help them recover from the cognitive portion of it. So, and then
What
again, these
about
are
with
people
people that are
that are
just kind of
well.
starting down that path? Like they're just
Oh
starting to
no,
get
no,
those.
and I encourage people because I'm seeing it, especially these last several years, as you mentioned, with COVID, geopolitical issues, and all this stress. I mean, just tune into the news for just a few minutes these days compared to even a decade ago. It's just terrible. So I'm seeing people now at even younger ages. We're talking 30s, 40s, that are really having a tough time with memory, staying attentive. It's affecting their career, affecting their work, affecting their relationships with their spouse because they can't remember things that their spouse may have told them, important things. So in those situations, yeah, it's absolutely recoverable in my opinion. Again, doing the right things. And neurofeedback, as I mentioned before, is the definitely the foundation we start with. But even if you're in your 60s or 70s and you're seeing that dementia, but it's not to the point where it's a full blown Alzheimer's or something of that nature. Yes, it can still be at least halted, and that's the important point. We don't want the brain to degrade any further than where it is.
Right.
And in my opinion, again, especially with a lot of the different technologies out there that I've worked with, that we have all available to us, we can do something about this, and it's only going to continue to get worse. I mean, as I've even before I got into neurofeedback, those of us within neuroscience and us professionals that specialize in helping people with neurological conditions, we saw the coming of a neurological epidemic, and we're still in those beginning phases of it, but especially now with the last several years of COVID, isolation, vaccination, and all those things. I mean, even just suffering through COVID one or two times has an effect, and there's numerous studies to show this has an effect on brain function, creates inflammation in the brain. All these things are just poisoning the whole population throughout the whole planet to be
Yeah.
much more susceptible to brain-based disorders and other neurological disorders throughout the body too. So we're in that realm. And again, how I know this is because again I'm seeing younger people with these memory issues and cognitive issues. So the best time to take care of it is when you first start to notice those things that we kind of joke about. You hear people conversing, oh yeah, I forget these things, or I have a tough time remembering names, and we kind of joke about it in our day-to-day life and think it's just normal because everyone else is suffering through the same thing. But the reality is it's not normal. That's
Right.
not how we should be going through day-to-day life.
Even with speaking of COVID, one of my provider friends, it was the first time I'd seen it, and I've seen it a few times since, but she had a client that provided a really nice video testimonial. She was a fairly high profile person, and she got COVID and she just could not function after it. And she had a
Mhm.
very demanding job, with accounting and working with this kind of high profile celebrity guy. So she went through the neurofeedback and it completely fixed it. Right. So I guess that's long COVID, right? And then
Yeah.
it's amazing to know that neurofeedback can be such an impact for that even.
Yep. Yeah. That's
So
definitely, yeah.
sounds like we're just kind of like, shilling for neurofeedback.
And to
You
further
know,
come back and touch on your point about these sensors, yeah, for those that may be apprehensive, again, where I'm looking to take this again, last 5 or 6 years has really brought my practice as well as other practices the ability to bring this into a home setting, which makes it more convenient, especially with our day-to-day busy lives that we all have, and especially kids that are doing this because of their ADD or ADHD or
yeah,
different problems. The ability to do this from home makes it so much easier, but where I envision this now too. And again, if we can do that initial study, that QEEG, that's always the gold standard if we can. So to know that there's technologies out there, and they're only going to continue to keep getting better. I think that'll really be a game changer in bringing this to that next level, and more people will become aware. In fact, what I'm seeing now in this past year in my practice is people are discovering it. Not only they're discovering not just for themselves or perhaps their child, but now I have whole families that are coming on board because they're realizing they all have just these little nuances of whatever brain-based conditions. So I have whole families, and it's wonderful to be able to work with the
yeah,
whole family. And what's great about that is that one person, especially children, they don't feel isolated that I have a problem and I got to go through and do these therapies, although they're easy to do. In fact, most kids love doing this because they get to watch YouTube videos or movies. But it's nice to be able to see the whole family come together and do this and support each other and help each other and setting themselves up on their sessions. Something I never would have even dreamed about 10 years ago when I first got into this, because everything was done in a clinical setting. Can you imagine trying to have a whole family come in? I mean, we'd be blocking 2 hours of time to get that whole family through. What kind of family has that time these days?
Right, right. I would
Yeah,
imagine
so
that, maybe we can just close on this. The advantage of one of the other advantages of doing it at home, and not to say that, doing it in office has any real downsides. I mean, it's a great thing to do, but if you do it at home with a provider like yourself, I know that actually gives you significant cost savings as well, right?
yes.
Makes it more accessible,
Oh yeah. Yeah.
So definitely worth having a conversation with, yourself, for anybody that's interested, and just find out more, right? I mean, if it's a fit, great. If it's not, at least right?
Exactly.
And it could be something that just, is the beginning of kind of a big change in your life, So I really appreciate your time, John. Thank you so
Oh,
much. And again, just visit the links in the video, go to his profile and find out a bit more, book that consultation, or at least download his ebook, so you can learn more about, neurofeedback and how it can help you.